Thanks so much. So we need a little audience participation here. The thing that I've been alluding to as a surprise for the end of the day is that we intend today to give an award to 5 individuals that have been attending this conference. These are sort of lifetime achievement awards for their contribution to the field of pain. 3 of them, it probably won't be any surprise to you. The next 3 speakers that were key critical members of the Office of Pain Policy will be amongst the first recipients of this award. The other 2 will be Chris Beasley and Tom Norris. So this trap door here, we didn't even know what it was for. Where is it at? Where?
Just sitting next to the bed.
Next to the bed. So you may recognize this award. We made a replica of the Golden Neuron Award that we received last year. We were so proud of receiving the first Golden Neuron Award for interdisciplinary team science, and what we felt we needed to do was make a replica of this award because the people we're giving this award to wouldn't otherwise be able to receive an award like this. NIH program officers, until they get prematurely terminated, probably aren't going to receive an award like this. USASP has some awards for people like Tom and Chris, and maybe they will receive such an award, but this is something that we at the Chronic Pain and Fatigue Research Center and our community of pain researchers think is just incredibly important to give these awards. So we are going to ask Linda, Janelle, and Laura to give their talks, but we are asking the audience to help name the award. So on Slido, we have a bunch. Open now. Okay, so please help us name this award. This is, and the reason that none of them are going to go home with the award is, first of all, we couldn't get 5 made in this short a period of time. And the second one is we wanted the audience to help us name the award and participate in the naming of the award. They will each get the award with their name and an engraved plaque with the name that we come up with in the next 45 minutes or so. I'm not going to do long introductions of the individuals. I actually think that the talks that they give will speak for themselves, just as I think the people that have been in the audience today completely understand why people like Chris Beasley and Tom Norris are receiving this award. So again, we will make very short things to them about the award, but I think their body of work is known to everyone that's attending this conference, and it's pretty obvious why they should be receiving this award. So I don't know who was first on the program of the 3. Why don't the 3 ex-NIH program staff come down, and maybe you can all sit here and each give your talk. So Laura's first. I see Laura, so I'll...
Linda's first.
Oh, Linda's first. Linda, okay. So Linda. Linda didn't know this, but in 2019, when she was being put up for the director of the Office of Pain Policy, Walter Korschetz, the director of NINDS, reached out to me and asked me if I would write a letter of recommendation for Linda. She never saw the letter of recommendation. It's somewhere in her file. But in that letter, I gushed about Linda, and I said, I think that she's actually the single most important person in the field of pain. In that, Linda, in the very early days when there was no coordination of pain research whatsoever, she behind the scenes put together the pain consortium, got the institutes to talk to each other. When the HEAL initiative came up, she was an obvious person to lead the pain part of the HEAL initiative, and she led it incredibly well. And again, I just think the world of Linda. Linda was intending to retire. Unfortunately, her retirement was premature, and some of the celebrations that they might have been able to have internally at the NIH to celebrate her success were not possible. So we hope that this partially makes up for it. So, Linda?
Can I say thank you and then start my talk, or are you going to move to these?
You can do whatever you want.
It's
my time. Your words are so deeply appreciated. I think for the team, I want to say thank you, not only to these two, Laura and Janelle, but beyond that, to the other people that worked in OPPP for so long. It's no longer their job, but this is still their passion, which is why these guys are here. And, they never really had a chance to get together after their jobs were cut, to say goodbye to each other, to be recognized by the NIH for all the work they did. So Dan, this is huge, and I will pass it along to them. And when we get these, we're gonna have a little party and show them to everybody because it belongs to all of them. So most grateful to the kind words. Okay, and you left me the box of tissues there, just in case, right?
Oh, me too.
Okay. Okay, so I need to find my slides. And this is, and Chris is still helping me out. She's been doing this like forever and ever.
You're right here somewhere. Here.
Not just with my
There you
slides. Great, thank you. One sec. Oops, that's not mine.
Can't see close up, so I had to take posters on a quarter. Yeah. Go back to that. Go back to that. Sorry.
Oh, there's us.
Yeah, there's us. There you go. You should be on here. No?
Nope.
There you go. Porter. There, that one, right?
Yeah, should be.
Okay.
Hope so. Yes, this looks familiar. So Chris did a beautiful job of sort of where do we go for the future. And so what I'd like to do in the next 20 minutes is talk about how we got from where we started, which was pretty much nowhere, to working into an era of pain research that Roger Fillingen very kindly called the golden era of pain research. We've hit a setback, but I think that with all the work that Chris and her group has done, and Diane, and so many other people in the room, Tom, everybody, that we will recover. Perhaps won't look the same, but we will recover. This laptop is completely different from mine. So one thing I wanted to start by saying is that advocacy partnership is done often in a collective manner. And so here I've got a short list of the collection of voices and implementers, I call movers in the slide, of who's been helpful in moving the research agenda forward in the pain area through the NIH and sister agencies. But those collective voices usually start with an individual. And so someone comes forward, forms a partnership with someone else or some other group, and those voices are really what builds the inertia to make the changes. This little list here is a very short list of people who I've worked with over the years that have really made a change in the world of pain research. And there's just a little tiny descriptor of what they've done and what they've accomplished. But if you have the time to ever look them up and see how much of an impression and how much passion was put into this work, it's a wonderful story. So let's go back, 2003. I had recently joined the NIH, took on a very tiny little pain research portfolio through the NINDS that was kind of messy. And at the same time, Dr. Zerhouni, a new director of the NIH, said, we need to pull the pain research agenda a little bit more together across NIH. So he said, time to reinvigorate the NIH Pain Consortium. And so we got a meeting. Larry Tabak was the lead then. Story Landis was just coming into her own for lead. And Pat Grady from the Nursing Research Institute were kind of overseeing the pain research agenda, but it was all institute by institute, as Dan said, very siloed. So at this meeting, the early challenges were discussed. We didn't have defined goals for a big research agenda across NIH. We didn't have money to support it. We didn't have a plan to move forward. We had no means to give an outreach out to the community or to pull them in. So we had a lot of work ahead of us. And all the program staff who were at that meeting didn't actually hold pain portfolios, but held some pain research grants in their portfolios. And so when leadership of the meeting said, we need somebody to kind of step forward and begin to coordinate this effort. And I had just gotten there, so I said, okay, I'll do it. Little did I know that it wasn't as simple as it looked, but everybody really sort of stepped up and contributed. So early on, we looked at what we had for a portfolio, and this little graph here shows you that NINDS did a lot, the other institutes didn't do that much. We had no clue what was in those portfolios. So we realized that it was kind of skewed because we coded at NINDS for pain, some of the other institutes didn't. But what we did learn, we were probably under $200 million in pain research funding at that time. Very small amount. We knew a little bit of whether it's basic, clinical. We didn't know much. At about the same time, the research community and the advocacy community kicked in and said, you guys, you really need to put more money into pain research, more resources. And so David Bradshaw, University of Utah, and put together a program to assess the NIH portfolio, how much we spent, what the institutes were involved in as far as type of research, whether it really was pain research, where is an outcome in pain in the research grants, or it was just, a question mark in the program for the grant. And is it basic or clinical? Really, really basic. What was the pain driven by? What organ system or disease is how they defined it, which tells you at that point, we weren't thinking of chronic pain in any way in a disease of itself. Early days, we've learned a lot. So their goal was to determine what the gaps were in pain research, let the NIH know what the outside world saw it, how the NIH world saw it, rather, the outside world saw it, and whether funding announcements that were going out for pain were effective, did they get good research, and how they would track funding over time. So NIH, at that point, we sort of saw these folks as the critics of NIH rather than partners. That kind of vision and perception has changed drastically for the good over the years. But what resulted from their voices and our, at least initial inertia to bring the Pain Consortium together and change things at NIH was we started talking about what shared interests we had across NIH and the pain research arena, what funding announcements we might put out to bring in more multidisciplinary research, what kind of resources we could tap into. The Pain Consortium had $0, but we had other areas where we could go, the Common Fund, for example, Roadmap then, to actually fund research that was multidisciplinary. We put together a program to have annual symposia in the pain research arena that went for 20 years. We had our last one last year for reasons well known to most of us at this point. We did workshops, we put out a listserv for outreach to the community, and then thought about things beyond just funding grants. We need better workforce. We need a more enduring workforce. We need to share the data, and we need to think about more multidisciplinary trans-agency efforts. And the little graph down here, I think Chris has already showed you this, but we start way, way back in 2003, a couple $100 million, and now we're up over $1 billion. Could still use more, but it's been a good increase. So big change that came along quite a bit later. Again, this is the voices of many different groups, many different people pushed a pain care bill. It didn't make it through Congress in 2008. It made it into a smaller bill in 2009, but finally, it's in the Affordable Care Act. And that Pain Care bill called for a number of really different important things to happen, which really did change the research arena, but well beyond that into addressing pain care, pain prevention nationwide. So the Pain Care bill in the ACA called for an IOM conference on pain. It called for NIH to beef up its pain research programs, to ask the Common Fund for big research programs and in the pain area, and also to establish an interagency committee that would work across all of the HHS sister agencies to coordinate their pain research programs. Turns out they've been a very valuable resource, and also to fund PCORI. So the Institute of Medicine report, in response to the Pain Care bill, gave us the opportunity to designate the lead institute for pain. This is where the Office of Pain Policy and Planning was established at NANDS, but it was trans NIH, to increase support for the Pain Consortium. So we built up our staff over the years. OPP started out with 3 people. We're kind of back to that number right now, unfortunately. But also to look more at interdisciplinary research and different types of research that they thought were important. So those goals led to a roadmap for what I will tell you very briefly was the National Pain Strategy and the Federal Pain Research Strategy, which actually helped to set up the goals and objectives for the HEAL initiative. And so it turned out to be a really important document. The Interagency Pain Research Coordinating Committee had, I think, several really high-level accomplishments. They wrote a national pain strategy, and that was in coordination with scientists and healthcare providers and advocates across the nation. It took a year or 2 to put that together. It was a set of achievable objectives for the nation to improve pain prevention, pain care, access to care, education, and public awareness. It was an unfunded mandate, unfortunately, but some of those goals have been achieved through different resources. The IPRCC also put together the Federal Pain Research Strategy, portfolio analysis, strategic planning, and really developed the HEAL initiative. They had, the IPRP was probably the best portfolio database that was publicly accessible that I think we've ever had at NIH, because it was hand curated, all kinds of information in there that was useful from the public looking in at what we were doing. Unfortunately, it wasn't sustainable because huge staff involvement in keeping that going. The IPRCC earlier this year was working with several current work groups built in as subgroups of the IPRCC and some outside people. A lot of good energy, a lot of good conversations in these 4 areas that I've listed here. Laura and Janelle were involved in their conversations, and the hope was that we would move some of the initiatives that they would propose forward. Unfortunately, the IPRCC has kind of come to a halt again through restrictions in staffing. We aren't able now to get our membership approved. The membership was leads of advocacy groups, care providers, and federal staff. So this is kind of, let's call it on pause for now, which is unfortunate. This is an example where the Interagency Pain Research Coordinating Committee voiced opinions through a very sort of strategically loaded agenda in one of their meetings. So shortly before the CDC guidelines were about to be released, there was a lot of concern about how restrictive they were. Excuse me. The fact that the feeling was that they had been set up behind closed doors. And so we loaded the agenda for the IPRCC meeting at that time with the ONDCP, with DAA reports, with the CDC report on the guidelines. And it kind of was, excuse my language, kind of all hell broke loose. And so they decided to write a letter to the secretary. The outcome was that the CDC paused, put out the draft letter for the guidelines until they could go out for public comment. So, sort of a very contentious thing, but I think it had a good outcome. Healthy people is a lot to explain, so I'm going to skip over that. But if you can ever look at the healthy people objectives, pain was put into, this is sort of a way to look at the health of the nation and how we're progressing, was put into Healthy People 2020 through the efforts of Mark Pitcher, who wrote the first paper on high-impact chronic pain, and Chad Helmick from the CDC, who got the National Health Index Survey to include questions on pain. There were none prior to this, which is kind of crazy. Common Fund. This has already been talked about. It's wonderful. Your folks are here that lead this program, and so I don't need to go into details, but the request for the Pain Consortium to put in applications to the Common Fund was statutory in the Affordable Care Plan. We'd been doing this for years, but it finally went through, and it's a wonderful program. Enough said. The ACIA also put together the launch of PCORI, which has been a wonderful organization to include patient voices in everything they do, from development through implementation to review to outcomes of their studies. They have funded over 300 pain-related studies, primarily pain, and the IPRCC and the Pain Consortium has worked for them to learn from them good engagement strategies. HEAL, I think you all know HEAL. This was, I think, a strategic maneuver when we talk about partnerships and how to make a difference at the right point in time. Francis Collins had been in conversations in response to the opioid crisis with Pharma, which is a group of pharmaceutical companies that puts money into good programs, and they were negotiating, putting funding into the opioid crisis for research reasons. And Dr. Collins took this to Congress and said, would you rather fund this or have the pharmaceutical companies fund it? So Congress gave us the appropriations for, that's a simplified process, but it was strategic. And they gave us the money for the HEAL initiative, and hopefully, as Chris has pointed out, we have our fingers crossed that that's going to move forward. It's an incredibly huge advance in the pain research arena, and as you can see here, I won't go through the individual programs, but it covers discovery all the way through implementation of research funding. And so one thing I wanted, and it's been said over and over today, that as we move into the future, the game changers behind all of these things is that we have made good research advances, and we need to continue to do that, and we need you guys to do that, and then also to get the messaging out to the right people at the right time about how important these research advances are, because they help every component of the pain care community, from healthcare systems to healthcare providers to people with lived experience, to really make their lives better. So crucially important that you guys keep up the good work and be good advocates for pain research. And then finally, this slide is probably kind of silly, but because some of it doesn't exist right now. But the idea was, how can we help you? Yeah, it is a weird humor, I know, but that's kind of where we are now. So Laura helped to put together a series of webinars, like if you're submitting a grant for different types of research, this is where you can go and learn about it. That was on the Pain Consortium website. We do have some programs that still exist. The NOFOs are in question as to when we'll be releasing funding announcements, how often we'll do it, what they're going to look like, how detailed they'd be, still up in the air. So it talked about program staff, who was in the Pain Consortium, who you should connect with if you want to submit a grant. Short news is, the website's gone. And so none of this is really available right now, but some of the programs still are. And I think, Laura, you're going to talk about loan repayment can be super important for some people at early career stages, so I will leave that with Laura. But I want to echo the thank you that Dan has made to OPPP. And you can see here, this is a bubble chart of the primary areas that OPP has worked in over the years. And really, I think, made an incredible contribution, and we're going to be really happy to share that. And these are some of the names of the primary people that have been in OPPP in recent years. There are a few people from way back that I left off the list, or maybe who only came and went for a month or two. But what's happened recently, and I was told that this is a very brutal slide and I probably shouldn't put it up, but I'm gonna do it anyway. We have a handful of people who left because they went on to their next career stage. That was all happy. And then we have a handful of people who are still at NAH because we were able to move them out of the pain policy office before it was abolished. And so they're still there. And Elizabeth Sipek is here somewhere, and she's on that list, which we're very happy. And then we have a group of people who on April Fool's Day at 5:20 in the morning got a note and said goodbye. And and then we had another day where several people got notes and said goodbye. So we have a core group. They're still passionate about what they do. They're working really hard to put back together some of the programs. And so we wish them the best and appreciate all the hard work they're doing to fill back the holes. So thank you very much. I'm going to turn to Laura.